COVID is not like anything that we have ever seen before. The flu kills 20,000 people a year, and we are over 250,000 people have died, and it hasn't even been a year yet. So the magnitude is huge, and we don't even know what all the repercussions are yet. I think we need to think about COVID in terms of smallpox, in terms of polio. I mean, this is a big deal. This is not a flu. The vaccine is really cool. I was initially pretty skeptical about it. How can you do this so quickly, so rapidly, and it be okay? And so, not till I did some reading and to learn a little bit about it, and it's just fascinating what they're able to do. I think it's important to understand that this is an international endeavor. You have the best minds in the world working on this. And then the way that it works is really neat. The coronavirus uses RNA to get into your cell to reproduce itself. And then the virus reproduces itself and kills the cell and lets more of it out so that it can kill more cells. And so that's what RNA or messenger RNA is. It's a glob of proteins. And so what they've done is they've selected just that portion of the protein. So you're building up the immunity to that attachment. And so that way the virus can't get into your cell to make you sick. So there's no way you can get the virus because it's not there. The virus is not put into you. It's just the protein of the messenger RNA, that little piece of the virus that gets into your cell. That's all they've replicated. And so that's all you need to build the immunity to. It makes it seem so much safer to me. It's not like we're putting the whole virus into your body. And that's also part of the reason that they're able to do it so quickly is that they don't have to manufacture that virus over and over and over. And so we as healthcare workers are in the muck. We're in it all the time. And so we're exposed to it. And yes, we can wear masks. That helps. We wear gloves. We wash our hands. But until we can get enough people that are immune to it, we're going to constantly be after that. The hospital and the physicians and the medical providers, we're all working very hard to keep everybody as safe and healthy as possible as we work through this. And it's really a great tool, and we need to do it. It's part of what we as health providers do, is to set the example and to reach out there and keep ourselves healthy and the rest of the community. If anyone has any questions at all, come find me. I'm happy to talk to you about it, explain what I've read, explain what I know, and I think that would go with any of the other physicians in the institution. Don't hesitate to ask questions. We're here to help.